Good afternoon. My name is Dr. Petrikovsky. I'm a professor of obstetrics and gynecology, and the content of this video does not necessarily agree with the institution I am affiliated with. I recently produced a video addressing the research on the masks, and although it's recent, I met with some criticism for lack of expressing my personal opinion. And as I know from the very beginning, most of the videos that I put together are just an interpretation of the peer review articles. So I usually try to stay away from my personal opinion. But I think in this particular case is really important. So I will come with a recommendation that I strongly feel. Number one, World Health Organization recently addressed the issue whether coronavirus is a droplet transmission or an airborne transmission. There is a very big difference between the droplet transmission and airborne transmission, and that has to do with the size of the particles. The particles more than 5 microns are usually heavy particles and transmitted when somebody is sneezing or coughing. So you need an active propulsion of the particles in order to infect another individuals. While airborne transmission, the particles are less than 5 microns. Don't forget that human hair is about 60 microns. So it's like 5 microns are significant, almost 10 times smaller than a human hair. And those could be transmitted by a simple speech. So once we got this information, we really need to come a little stronger on the recommendations. And what I say is follows, based on the peer review article and my personal experience with COVID, that I actually was facing the patients since the beginning of the pandemics. I think the most important thing is social distancing. Because if you keep social distancing, it definitely prevents you from being exposed at least to droplet transmission. And I think that in COVID infection, there is a combination of droplet and airborne transmission. So social distancing is a good thing to stay away from droplet transmission. Till now, we don't know what the percentage of droplet versus airborne transmission. But wearing a mask properly, preferably surgical mask, not a tissue mask, and handling the mask in an appropriate fashion, theoretically can prevent both droplet and airborne transmission. So I would probably comply and agree with the current recommendation of the majority of the physicians or the majority of the researchers in the area, understanding that basic science research is lacking in this area, and it's more anecdotal or personal opinion, is clearly when somebody is considering meeting a large number of people and come close to them, wearing mask is a reasonable and probably necessary precaution, because it will not hurt. But what's very important is what type of mask you wear, preferably surgical mask, and that the mask, especially the external surface, that in the worst scenarios contaminated by the droplets infected with COVID-19 should be handled as such, should be handled as contaminated surgical instruments or contaminated surgical mask. They should be discarded. So I think that until further research clarify the issue, we should be on the cautious side, listen to the recommendation currently promoted by the major health organizations, stay safe. Thank you.